So I'm going to do that from face to face and then face to side. After I've pulled everything down and in, if I'm calling in towards like the pelvis area, then I'm going to flip around to the other side, and I'm going to do from the top of the ilium to the bottom of the trochanter, pulling everything up and out, really focusing around that socket where the head of the femur is inserting at. That would be step number 1 technically for the sections that we're doing. Then I'm going to be coming down into the second section. And generally when I'm doing, if somebody's booked for like hip surgery or something like that, I'm going to be focusing on this area for like 30, 35 minutes, and then I'll be splitting it up, doing maybe about like 10 minutes here and like 7, 10 minutes on the hip flexor. But for what we're doing today, we're splitting everything up completely even, so we're going to be doing like 20 minutes on the hip, 20 minutes on the IT band, 20 minutes on the hip flexor. This just popped out. Okay, so after I've done top of the ilium to the bottom of the trochanter, the first section, from face to face, face to side, face to feet, and face to side, I would technically just stay there, over there, face to feet. This is just for me to explain right now. Then we're going to be tackling the iliotibial band. The iliotibial band is about 1 inch in width, and it stems from like the bottom insertion of vastus lateralis, that's right by the knee, and then it attaches right up here at the bottom of the trochanter area. And that is going to be the largest tendon in the human body. People think it's like a muscle, but you have muscles right above and below. We got our quads and our hamstrings, but generally right here, that's the largest tendon. And you go to touch it, and it feels like a tough cord, like beef jerky. Because before muscle bellies dehydrate, tendons and ligaments will. So if I ever see anybody with like adipose tissue or a lot of like muscle atrophy, and I can see that they're like starting like to atrophy within the muscle belly, I know that their tendons and ligaments, so their joints are pretty shot. So, shot, like they're not in good condition. So, I've done the top portion of the hip. That is done. Now I would be technically face to feet. Because it is more of a muscle belly, this is what we were reading in the first day during the guidelines in the book, and there is attachments of it. It's not just a joint that's hanging out there. We want to touch on origin and insertion. So for about 30 seconds, I'm just going to touch at the base of the trochanter, right at the gluteal process where the actual iliotibial band inserts at. And then I'm going to touch down right beside vastus lateralis, beside the knee, and I'm going to open up where it inserts at technically at the base for the iliotibial band. Once I've done origin insertion, hopefully that loosened off a little bit of slack in between. And then I'm just going to go face to face and face to feet, but I'll start face to feet. And I will windshield wiper, opening up that iliotibial band all the way to the top and all the way to the bottom, stripping down the middle, the medial, and the lateral sides of it. I'm going to do that from face to feet, flip on over, and then I already touched on origin insertion, so I would just start stripping that iliotibial band from face to face. After I've done that, we're going to get her into a different position, and we're going to work the third section, and that would be the hip flexor. But since we're 2 positions in, and I don't want to move her just yet, because then it kind of keeps like an easier structure for us to remember, are you guys kind of comfortable with that for me to demo it? Yep, perfect. Okay. So I'm going to begin with a nice airplane landing, effleurage massage, coming up and over. I'll just need a lift. I always just want enough oil that like my hands will slip along. I'm not dragging, but I'm also not just like sliding off her skin. So that's just a little bit of my thumbs. You can see how sensitive these iliotibial bands are. She really likes that, doesn't she?